Have you ever gone to the doctor and have them tell you everything looks good, only for you to go into my chart and then find that there's something abnormal that they didn't even mention? I'm Dr. Katz. I'm trying to distract my cat right now so I can make this video, and I'm also a non-invasive cardiologist. In today's video, we're going to be talking about echocardiography, or ultrasound of the heart, specifically trace regurgitation and what that means. An echo is an ultrasound of the heart. We use sound waves like how bats see or hear in order to turn a 3D structure into 2D image. And the most common question that people have is what trace valvular disease means. There's stenosis or narrowing and regurgitation or leakiness. There are 3 degrees of how we grade valve disease: mild, moderate, severe. Why don't I actually show you what it looks like? So these are images of the right ventricle looking at the tricuspid valve. And here we have mild regurgitation leading to moderate regurgitation and severe regurgitation, which looks even worse. The reason this is important: when a valve becomes severe, it leads to heart failure and death. Thankfully, there are a lot of modern technologies and tools that we can use, so we don't have to crack open your chest, but unfortunately, we still do have to sometimes. And it's important that we keep track of what degree your valve disease is. If you have mild disease, we typically recheck an echo in 3 to 5 years. Moderate, we check it every 1 to 2 years. And if it's severe, we do it at least once a year, more frequently at least every 6 months, while we monitor patients clinically to evaluate for symptoms and other factors, as well as certain echo parameters to decide when should we go for valve replacement or repair. Trace regurgitation is even below that. You have mild, moderate, severe, and below that's trace. It's sometimes physiologic, meaning when your valves open and close, sometimes they don't close perfectly. It's kind of like if you turn off your kitchen sink and one drip happens. You're not gonna call a plumber for that. It's fine. And for the most part, it's nothing to worry about. The only valve that typically this isn't completely normal in is the aortic. But if you see trace mitral, tricuspid, or pulmonic regurgitation, the reason your doctor may not have mentioned it is because clinically it's irrelevant and doesn't matter. I will often treat this as if it's mild and maybe recheck an echo in 3 to 5 years, just to make sure it hasn't gotten worse. But for the most part, it's nothing to worry about. That being said, if you have questions about your specific echo report, talk to your doctor. Or find a cardiologist if they can't answer your questions. Or find a different cardiologist if they won't answer your questions. If you're in North Jersey, come find me. Hope that helps. No cats were harmed in the making of this video.